a nonprofit psychiatric treatment center. Carol Burns Smelly started it in the 60s. Residential treatment centers that existed were more like boot camps or training programs for kids who had broken the law. And she really dreamed of opening an organization where kids who had mental illnesses could come and live in a home-like environment and receive the treatment and care they actually needed. And we've really done that, but expanded it to people of all ages and then people all over the country. As long as mental illness exists, our mission will be the same. We do address a need in Arkansas for quality behavioral health care. We have 2 residential programs, both for youth. One of them is a qualified residential treatment program for foster kids, and the other is an intensive residential treatment program for kids all over Arkansas and military kids across the country. We also have an outpatient clinic, and they also do school-based services for kids across the state. When they come, they normally stay for 3 to 7 months, and while they're here, they get group therapy, individual therapy, family therapy, recreational therapy, all kinds of therapies. Something that we teach is like etiquette and household chores and basic living skills, social skills, and we'll teach self-awareness, impulse control, empathy, help them learn to have healthy relationships with other people so they can enjoy a higher quality of life. And then they have leisure time where they can play video games and build puzzles and do whatever they really want to. What I really like about Youth Home is we offer trauma-informed care across the board. Whether you're on the maintenance team, kitchen team, if you work on our campus, you're intensively trained in that because our kids come with trauma, and being able to respond to that effectively and in a way that'll help them is really important. You would think that most kids would know how to have fun, but when you experience the kind of stress that they do, it is really hard to trust the people around you. The kids that we serve are not bad kids. They're smart and creative, and they do work very hard while they're in our program. They also train the kids to give back to the community. In the past 6 months, our patients have gone to the Arkansas Food Bank and packed food. They have gone to assisted living centers and hung out with the elderly. For the patients that we serve in Little Rock, they will go back out into the community and they will have learned the skills they need to be contributing members to our community here, and they will understand the ramifications of mental health and be able to help other people in this area and offer their expertise and resources and learn to be just a good neighbor. A lot of times we have kids come back 5, 10, or 15 years later and tell us about the impact the program had on them. We are really proud to be finalists of the SBIA Community Impact Award. It was exciting that we would get a chance to share our story with the community. I think it made our people really proud. They do a lot of hard work without a lot of pats on the back, and for every person in the organization, this is something they can wear with pride.